Okay, good morning to all the students. We are coming up with a whole new lecture series on surgical topics, which will cover your whole the competitive aspect, okay, academic aspects, okay, and especially we are coming with the lecture series for the next student. Okay, later on we will cover the Ayurveda aspect also in the new series. Okay, what is the very firstly I want to inform to all the BMS students ki what is the next examination. Okay. 2023. Okay, ध्यान, remember the date 20 December 2023. Okay, on those students who have completed their internship before 20 December 2023, they don't have to give the next exam. Don't have to give the next exam. Student who have completed after 20 December 2023, they have to give the next exam. Okay, they have to give the next exam. What is next exam? Next exam is the national exit test. Okay, what is this? It is a national exit test. Student or the graduates, okay, student or the graduates after graduate after 2012 23 2012 23, they have to give the next exam. Or very interestingly, and I have a sympathy for you, those who have passed on 20th December 2023, they also have to give the exam. Okay, so those who have cleared their BAMS before 20 December 2023, they don't have to give the exam. Okay, next national exit test will, the score will decide your PG seats, and whether you will do a practice or not, it will be decided according to the score of national exit test. Okay, next point. ठीक है. Later on we will also come add our Ayurveda lecture 2, which comprises also the academics as well as your the competitive aspect, which will cover your competitive aspects. Now let's start with the today's topic, hemorrhoid. Okay, hemorrhoid. What is hemorrhoid? Definition. Yeah, it also called it as a piles. In a lay language, also called as a piles. ठीक है. Hemorrhoid is comprises of the Greek word hem means blood, roid means to flow. Hem means blood, roid means flow. ठीक है. Now we will talk about the definition. What is the definition of hemorrhoids? Prolapse of rectal cushion. Prolapse of rectal cushion. ठीक है. Or another definition you will come across in the different books, tortuous and dilated veins. Tortuous and dilated veins of anal canal. Okay. Okay, any confusion? ठीक है. Now we will cover some anatomy and I'll make you clear about this definition in that. Okay, come on. As you can appreciate this picture, this is anal canal. This is totally a anal canal. This is dentate line or pectinate line. The both are same. Some books write it a dentate line and some books write it a pectinate line. Okay. From anal verge to dentate line, it is about 2.5 centimeter. Okay, 2.5 centimeter. And from dentate line to anorectal ring, this is anorectal ring. Anorectal ring. ठीक है? This is anorectal ring, which is about 2.5 centimeter. ठीक है? Total anal canal is about 5 centimeter. ठीक है? Okay. Now, these are the measurement of anal canal, and I think so I had made it very clear. Now I want to tell you that what is anorectal ring. Okay. The anorectal ring is formed by the puborectalis muscles. Okay, formed by the puborectalis muscle. The puborectalis muscles forming an angle with the rectum, it is about 80 to 120 degree. What is the significance of this angle? As you can see, the anal canal is not a straight. It is not like a straight. It is a curved path. It is a curved path. It is a curved path. Okay? It is a curved path. Why it is having a curved path? Because why it is having a curved path? In a normal condition, while standing, while walking, it is the sling is normally in a contraction. Okay, it is having some angle, but while defecation, it relaxes. Okay, while defecation, it relaxes and it becomes straight. Okay, while defecation, muscle relaxes and the anal canal become straight, which is the defecation. Okay, I think it is enough to make you understand what is the role of puborectalis muscles and how it is making a anorectal sling or anorectal ring. Okay. Okay. Now, what is the role of now we'll talk about the prolapse of rectal cushion. Okay. Now we will talk about the prolapse of rectal cushion. Okay, this is our anal canal. 3, 7, 11. Okay. The most prominent blood supply is around 3, 7, 11 o'clock of the anal canal. it and it comprises of the cushion. Why it is called a cushion? Cushion is comprises of the, let me tell you, anal cushion or rectal cushion specifically. Rectal cushion. Rectal cushion. Okay. It comprises of outer mucosa, mucosa. Second, inner submucosa, inner submucosa. ठीक है, inner submucosa. Third, blood supply, blood supply. Fourth, muscular layer. Fourth, muscular. Okay, are you getting? When there is a prolapse of a mucosa, वो किससे इंटैक्ट है? It is intact with submucosa and the muscular layer. When there is a prolapse of mucosal layer at 3, 7 and 11 o'clock, it is called an hemorrhoids. There is mucosa of prolapse mucosa at 3, 7 and 11 o'clock. Prolapse mucosa rectal mucosa. Prolapse of rectal mucosa at 3, 7 and 11 o'clock is called hemorrhoids. As we have talked about the what is definition of hemorrhoids, prolapse of rectal cushion. Rectal cushion is made up of 4. What is constituent? 4 constituents: outer mucosas, inner submucosa, blood supply and muscularis layer. When all these layers get prolapsed, when all these layers get prolapsed, okay, when all these layers get prolapsed, it is hemorrhoids. Okay, okay. Now the tortuous and the dilated vein of the anal canal. What it is mean? Tortuous means irregular. Normally veins are straight and elastic. Okay, normal veins are straight and elastic. Normal veins are straight and elastic. But due to continuous external pressure, okay, continuous due to the external pressure, it get tortuous, irregular in shape. This is tortuous and dilated. How? And dilated. Tortuous and dilated. ठीक है? Are you getting? I think I am making very clear everything. Normal, tortuous or dilated veins. ठीक है? Now definition is clear. What is the definition? Definition is the prolapse of the rectal cushion, okay, and the tortuous and the dilated veins of the anal canal. I've made it clear both the definitions. Now we'll go on the classification. classification. Classification of hemorrhoid. ठीक है? On the basis of etiology, hemorrhoidal mass can be internal hemorrhoid and external hemorrhoid. On the basis of etiology. ठीक है? Internal hemorrhoids or external hemorrhoids. Then what are the internal hemorrhoids? Let's come to the anatomy. We will talk about the surgical aspects and the anatomical aspects side by side. Okay? ठीक है? Now you can see that we have already talked about the dentate line. Dentate line is the anatomical landmark. Anatomical landmark. Dentate line is the anatomical landmark which differentiate between the internal and the external hemorrhoids. Are you getting? What is the anatomical landmark? Dentate line. Dentate line is the anatomical landmark which will decide hemorrhoid is external or internal. ठीक है? Above the dentate line and below the dentate line, there are the only two possibilities. Above the dentate line is internal hemorrhoid. Okay? Okay? And below the dentate line is external hemorrhoid. Any questions? No. Okay, चलेगा. ठीक है? External hemorrhoids. Now, internal hemorrhoids are above the dentate line. External hemorrhoids are the dentate line. ठीक है? I think I made it very clear. On the basis of etiology, we have two hemorrhoids, internal hemorrhoids and the external hemorrhoids. Internal hemorrhoids are which are above the dentate line and the external hemorrhoids are which are below the dentate line. ठीक है? Another classification is primary hemorrhoid, primary and secondary hemorrhoid. And secondary hemorrhoid. ठीक है? It is on the basis of origin. Classification on the basis of origin. On the basis of origin. ठीक है? Primary hemorrhoids and secondary hemorrhoids. Primary hemorrhoids occurs at the site of of 3, 7 and 11 o'clock. ठीक है? And secondary hemorrhoids are other than other site other than 3, 7 and 11 o'clock. Huh? I think everybody is understanding what I am teaching. Hmm? Is it clear? What is primary hemorrhoid? Primary hemorrhoids occur at the site of 3, 7 and 11, and the secondary hemorrhoid sites other than the 3, 7 and 11. Okay. Now see. Okay, this is anal opening. Hmm? Okay. This is the condition of primary hemorrhoids. What is 3 o'clock? This is 3 o'clock, 7 o'clock, and this is at 11 o'clock. Are you getting everything? This is the normal condition. This is the primary hemorrhoid condition, okay, which is occur at the site of the 3, 7 and 11. I have already told you why at only 3, 7 and 11, because the anal cushion, rectal cushion is prominently dense at 3, 7 and 11. The vascular supply at 3, 7, 11 is far more than the other side, and you will see it in the anatomical lecture ki, what is the blood supply to the anal canal and rectum. You will clear from that. Okay. Now site other than here, other than the site of the primary hemorrhoids, all are the secondary hemorrhoids. Okay. Now we'll talk about the grades of hemorrhoid. Okay. Now let's come to the grades of the hemorrhoids. Okay. We will talk about this PDF. The grades of the hemorrhoid. Grade 1. What grade 1 tells you about? It is only visualized on the anoscopy. Okay. Okay. What is anoscope? What is proctoscope? What is sigmoidoscope? We will talk about it later, and I'll give you the idea about what is anoscope, what is rectoscope, what is sigmoidoscope. Okay. Okay. It is only visualized on the anoscopy and may bulge while during the defecation. The lumen but do not prolapse below the dentate line. Are you getting? But may bulge into the lumen but not prolapse, but do not prolapse. The main feature you have to keep in your mind is that it bleed. It bleed during defecation. Same in the second, prolapse out of the anal canal with the defecation or with the straining, but reduces spontaneously, bleed and secrete mucus. The most important factor you have to keep in mind that it secrete mucus and it bleed. Okay. And what about the condition of prolapse? Prolapse out of the anal canal with defecation or with straining, but reduces spontaneously. ठीक है. Now in third grade, prolapse requiring manual reduction. ठीक है. It remain prolapse while defecation, while straining, it get prolapsed and you have to manually reduce it in the grade 3. In grade 4, prolapse that cannot be manually reduced, generally mixed hemorrhoid that include internal and external component. Now see, I have talked about the one classification on the basis of etiology, internal hemorrhoids and the external hemorrhoids. ठीक है. In internal hemorrhoids, above the dentate line, हाँ, and below the dentate line external hemorrhoids. ठीक है. Now there is one component also called interno external, interno external hemorrhoid, interno external internal external hemorrhoids. In grade 3, in grade 4 condition, what happens? In grade 4 condition, what happens? In grade 4 condition, what happens? This is the anorectal ring, this is the dentate line, anorectal ring, dentate line. ठीक है. Above the dentate line, in the condition the origin is from the above dentate line. ठीक है. And it comprises of the external component too. I have told you about the anal cushion. Rectal cushion is made up of four components: mucosa, second submucosa, तीसरा blood supply, चौथा muscles. ठीक है. Now in the this component, which component? Interno external component. Skin is additional. Okay, are you getting it? It come along with the skin component. It is comprises of the skin component as well as with the mucosal component. ठीक है. इंटरनो एक्सटर्नल जो रहेगा, इंटरनो एक्सटर्नल is comprises of mucosal plus skin. ठीक है. Okay, it comprises of both anal cushion and the skin component. ठीक है. Now we will talk about the rectal examination. Okay, first we will talk about the clinical feature. Now then we will talk about the clinical examination. Clinical feature for internal hemorrhoids. ठीक है. Patient came to you with a complaint of mostly what the complaint make the what is the mainly a complaint from the patient side is he is feeling of a mass while defecation. Okay, feeling of a mass while defecation. Another, bleeding, per rectal while defecation. ठीक है. Are you getting? And internal hemorrhoid is painless. Patient will not complain you for the pain. Mainly it will come with the complaint of the feeling of mass and the bleeding per rectum. ठीक है? Sorry. हाँ, why it is painless? Let's see. As you can see that the nerve supply above the dentate line is from the visceral motor area. What? Visceral motor area, which is insensitive to pain. Okay, which is insensitive to pain. That's why patient don't feel the pain when the hemorrhoid is above the dentate line. Okay, and if the hemorrhoid is below the dentate line, it is supplied by the somatic motor sensory innervation. ठीक है, somatic motor inner sensory. Because of the somatic supply, because of the somatic nerve supply, clinical feature of external hemorrhoid, it is painful. It is painful. Painless or painful, it is in itself a differential to rule out whether it is an external hemorrhoids or whether it is a internal hemorrhoids. Okay, everything is making a sense. Are you understanding? ठीक है? Now, and in the external hemorrhoids they are thrombosed piles mass. Thrombosed piles mass. What happened? In an anal canal, this is internal, this is external, this is external. ठीक है? Superficial, there is subcutaneous blood supply. There is a subcutaneous blood supply at the anal verge. There is a subcutaneous blood supply at the anal verge, which get busted due to excessive straining and long sitting. We will talk about the risk factors which can cause this kind of the hemorrhoids. Okay, right now you keep in mind what are the clinical features of internal hemorrhoids and the external hemorrhoids. ठीक है? ठीक है? Internal hemorrhoid, feeling of mass, bleeding per rectum and painless. In this external hemorrhoid, it is painful and thrombosed pile mass. No per rectal bleeding. Okay. तीसरा, no per rectal bleeding. No per rectal bleeding. Are you getting everything? ठीक है? These are the clinical features of the external and internal hemorrhoids, and we have very much clarified about the internal hemorrhoids and the external hemorrhoids. We have as well as talked about the primary hemorrhoids. Okay, so far primary hemorrhoids and the secondary hemorrhoids. We have already talked about the grades of the hemorrhoids. Grades of the hemorrhoids is applicable to the internal hemorrhoids, and as we have talked about the grade 1, grade 2, grade 3, grade 4. Okay, and after that we have talked about the internal grades, internal external hemorrhoids, and right now we will talk about the differential diagnosis. Differential diagnosis. In differential diagnosis, solitary rectal ulcer anorectal cancer, diverticulitis. Okay, these could be the differential diagnosis of the hemorrhoid. Differential diagnosis of the hemorrhoids. We will talk about the solitary rectal ulcer, anorectal cancers. We will talk separately on that, and diverticulitis. And these whole are in itself a very big topic. Just keep in mind, keep remember these three are the clinical, the differential diagnosis for the hemorrhoid. Okay, per rectal examination. Okay, per rectal examination. On per rectal examination, what we do per rectal examination, DRE, okay, which is digital rectal examination. Digital rectal examination. ठीक है, and proctoscopy, anoscopy, and sigmoidoscopy. ठीक है, DRE we'll talk about it later. Proctoscopy, length of proctoscope, length of a proctoscope is 10 to 15 centimeter. ठीक है, length of a anoscope, sorry, length of a proctoscope is around 15 to 20 centimeter. Anoscope is 10 to 15 centimeter, and sigmoidoscope is 60 centimeter. Okay, it is visualize the whole anal canal. Okay, anal canal and whole anal canal, rectum, sigmoid colon. ठीक है, it is used to visualize. ठीक है, I think everybody is clear about all the three. Diagnosis for hemorrhoids. Hemorrhoid is clinical. It is clinical diagnosis. It is clinical diagnosis. Sorry. With the help of proctoscope. ठीक है, with the help of proctoscope. ठीक है, ठीक है. In DRE, what is DRE? It's a digital rectal examination. Digital rectal examination. Index finger is used to palpate anal canal. ठीक है, to index finger is used to palpate the anal canal. Okay. Hemorrhoidal mass is not palpable on DRA. ठीक है, hemorrhoidal mass is not palpable on DRA. Its diagnosis wholly solely made on the clinical examination with the proctoscopy. ठीक है, now we will talk about the management. Now we will talk about the management. There are two different kind of a management: clinical and surgical. Clinical management and, or you can say, medicinal management. Medicinal management and surgical management. Surgical. Now, the management is decided according to the grades of the hemorrhoids. Okay, in grade 1, in grade 1, in grade 1, in this condition, only bleed is there. Okay, only bleed is there. In this condition, you have to treat it medicinally. What will be the management for this? Lifestyle changes. Very first, lifestyle change. Lifestyle change. Okay, what lifestyle change? Second, plenty of water intake. Plenty of water intake. Okay, to avoid constipation, we will add laxative. Okay, we will laxative. Okay, are you getting? Lifestyle change, plenty of water, laxative, and fiber diet. We will add some fiber in his diet. Okay, this is the management for the grade 1 hemorrhoids, and this will continue for the 2-3 weeks. This we will continue for the 2-3 weeks. If patient is relieved, then it's okay. Now we will, after that, we will treat it as second grade. Okay, in grade 2, whatever be the management we are following in the grade 1, plus in grade 1 we also give the sitz bath. Okay, sitz bath. We make a patient to sit in a waterful bath. Okay, waterful tub, and they allowed him to do the contraction and relaxation of the anal canal. Okay, ठीक है, ग्रेड 1 हेमोरॉइड्स प्लस for the for the management of grade 2 hemorrhoids, we will continue as the management as we are doing in the grade 1, ठीक है, and we will add for this, and we can add sclerotherapy, sclerotherapy, rubber band ligation, rubber band ligation in this condition, ठीक है. In sclerotherapy, in sclerotherapy we used to inject the sclerotizing agent which fibroized the anal cushion or rectal cushion. Rectal cushion. ठीक है, which will fibroize the rectal cushion. Let's see. ठीक है. This is anal canal. This is the hem. This is the hemorrhoid. Okay. After giving the sclerotizing agent, they will reduce and get fibrosed. What? They will reduce and get fibrosed. Size will get 3, 7 and 11. The size will get reduced. Okay, due to fibrosis their size will get reduced. And their size will get reduced like this. Okay, and it will stop bleeding. What are the contents we used in the sclerotizing agent? What are the sclerotizing agent? Polydocanal, ठीक है, सोडियम मोनोहाइड्रेट, ठीक है, और 5% आलमंड ऑयल, फिनॉल, ठीक है. Okay, I have told you the mechanism how the sclerotizing agent works. ठीक है. Now, rubber band ligation. In a rubber band ligation, we have an instrument. We used it to ligate the mass. This is anal canal. This is the prolapsed. This is the prolapsed mass. Okay, this is the prolapsed mass. This is the prolapsed mass at the 3, 7 and 11 o'clock. Okay. With the help of the applicator, we apply a band over here on the base of the hemorrhoid. We apply a band with the help of an applicator, and with the time it gets shades off, and with the time it gets shades off. ठीक है, and with the time it gets shades off, with the time it gets shades off. ठीक है, how it is get shades off? Because due to bend, due to bend which causes constriction of neck, constriction of neck, which causes ischemia, and because of ischemia it's get shed off. ठीक है, it get shed off. Okay, it get shades off. You have to keep in a mind, it is always, it is always given above the dentate line, never below the dentate line. It is always given above the dentate line. Sclerotherapy, rubber band ligation, it is always done above the dentate line. If you do anything below the dentate line, it will cause a severe pain and the patient will kill you later. ठीक है, okay, come to the next. In third and fourth grade, surgery is the only choice. Surgery is the only choice. Okay, are you getting? Surgery is all only choice. What is in the third grade? In third grade we have talked about the patient have the manually reduce the prolapsed mass. Okay, so in third grade what happens? What are the surgery options is available? First, hemorrhoidectomy. Okay, in hemorrhoidectomy, open hemorrhoidectomy and close hemorrhoidectomy. Second, stapler hemorrhoidopexy. ठीक है, also called it PPH. ठीक है, also called it a PPH. ठीक है, hemorrhoidopexy. ठीक है, we will talk about both of them. ठीक है, this is our anal canal. This is hemorrhoidal mass at 3 o'clock, 7 o'clock and 11 o'clock. What we will do in a hemorrhoidectomy, we completely excise the mass. Okay, you will completely excise the mass and mucosa remain left open. Okay, we will excise it and keep it remain open. Mucosa keep remain open. You will excise it and mucosa remain open. ठीक है, are you getting it? If you excise it, it will leave some defect and we will keep it open. ठीक है, and just we will close with the anal gauze. Simple. And in a closed hemorrhoidectomy, we will suture this mass. We will suture this defect. We will suture this defect. How it will look like? how it will look like. It will look like this. We will suture it. This is we will suture it. This is how we will going to treat the patient with a third and the fourth grade hemorrhoid. Okay, we will do a hemorrhoidectomy, open or close. Open hemorrhoidectomy is called as a Milligan-Morgan. Milligan-Morgan. Okay, close hemorrhoidectomy is also called as a Parks hemorrhoidectomy. Okay, this is stapler hemorrhoidopexy. You will keep a name in your mind. They will not ask the procedure about it. Only it will ask about the how many procedures and what is the management according to the grades of the hemorrhoids. Okay. After that, we will talk about the other anorectal disorders, fissures, fistula. Okay. Today we will hold here only. Thank you. Thank you very much.